Ìpínlẹ̀ Èkìtì, ìpínlẹ̀ ẹ̀yẹ. Ìpínlẹ̀ Èkìtì, ulẹ̀ òyì ní. Ìpínlẹ̀ Èkìtì, ìmọ̀ ti gòkè àgbà o. Ayé ayé a ò láyé ọmọ fáyé.
Start that ball rolling. My name is Kyle Divine.
Ìpínlẹ̀ Èkìtì, ìpínlẹ̀ ẹ̀yẹ.
A healthy society builds a healthy economy, and for an administration that pays a premium on human capital development to achieve its restoration agenda, affordable and quality health care for the people is an essential ingredient. Hello and welcome. This is Ekiti On The Move. I am Tunji Saliu. Let's look at our quick text for this week. Welcome back. In focus this week, health care delivery, redirecting the indices upward again.
Just like every other thing, Governor Kaldefayami made an assumption of duty. The health sector was in a sorry state, and the state's performance in health indicators was abysmally low.
Basically, when we came in as an administration, there are quite a lot of things that has been neglected. The numbers were bad. In the early days, like every week there would be at least 2 maternal deaths, 1 or 2 maternal deaths. And we get these calls periodically. There is no, in the early days, hardly will you have a month. There won't be 2 or, 1 or 2 or 3 maternal deaths. We now did a basic evaluation of our facilities. And to be honest, most of them are in deplorable state. They've been neglected for at least 4 years. There was nothing going on. And they were abandoned by our citizens because they realized that it's better to go to these private institutions, even to the traditional healers or local birth attendants to get their baby delivered. So they kind of left our facilities.
Before Mr. Governor ascended, while waiting, he actually started gathering a lot of data about Ekiti State health indices. What we met was not encouraging in terms of the service delivery, in terms of reproductive, maternal, child and neonatal health, in terms of the implementation of relevant policies within the health sector, especially the PAC, revitalization policy, and all of that.
Intervention in the sector then became both urgent and strategic in order to realize the overall human development agenda of the government and to halt the decline. The task of rebuilding and retooling the health infrastructure of the state requires a huge resource. This makes the partnership with the relevant development partners very imperative.
Our first priority was to get back our partners, the development partners, to be part of what we are doing, just like they have in most states. So we applied, we get involved, engage them, and during this engagement, they get to know us and what we are doing and our performances, and that's how we started.
One of the things that Mr. Governor did was to pull the team together to meet with the federal government agencies to begin to look for support, external support, federal government support. You will recall that the World Bank has supported the health system in Ekiti State through what we call the Save 1 Million Life initiative, which is geared primarily to ensuring that mothers' health and children's health are on top priority. Through that program, we've had a lot of health institutions supported, their midwives, supported the community health extension workers who work there. in capacity building, in providing basic equipment, in monitoring the outcomes of health services being provided there.
Of particular importance is some policies that is required to drive change, to drive development in the health sector. That informed Mr. Governor implementing the primary health care under one roof policy, which migrated all the public health people working at the PAC level, migrated them to state. And that is the formation of the State Primary Health Care Development Agency. It was an integration platform that makes all programs, all public health programs, to reside in one place so that there will be seamless and holistic implementation that is devoid of silos, fragmentation, program fragmentation, and all of that.
For a government that has taken a clearly defined position of making human resources its greatest asset, with the belief that only a healthy and enlightened people could drive the sustainable development being pursued in the state, it is not too difficult to marshal a plan to salvage the health sector in an holistic manner. This plan involves a four-pronged approach revolving around infrastructure development, capacity building, staff development, and disease control. Meanwhile, as a quick measure in providing universal health coverage, the governor immediately resuscitated a free and qualitative health care for the young, 1 day old to 5 years, and the aged, 65 years and above. The free health is also extended to pregnant women who enjoy free antenatal and delivery services in the state.
0 to 5, we are giving them free vaccination, free health care. Even when they have the childhood illnesses, they can still come and be treated. None of them is pain. And that has encouraged most of our mothers to be bringing their children. And to be honest with you, we have seen an improvement in the child indices. The maternal mortality in Ekiti State has gone down. The infantile mortality, or 0 to 5 mortality, has gone down. But on the 0 to 5, we want it to go further down. We're still working to have a better number. So our indices are improving. The nutritional status is improving. We are actually having great improvement in the maternal and infantile health in Ekiti State. And I say all is due to this free health, that people don't have to pay out of pocket again.
Wá síbí láti wá register fún maternity, so àná ni mo wá. Ìgbà tí mo dẹ̀ ń fail malaria náà, so lẹ́yìn ìgbà tí mo register tán náà, wọ́n tún ṣe test fún mi ní lab. So mo wá tún padà wá síbí, wọ́n dẹ̀ tún fún mi ní abẹ́rẹ́ láti àná yẹn. So yòókù náà mo tún wá gbà léni pẹ̀lú oògùn tí wọ́n kọ fún mi. So mo dẹ̀ dúpẹ́ lọ́wọ́ ìjọba náà tó dá iléeṣẹ́ hospital yìí sílẹ̀ náà tó ń tọ́jú àwa èèyàn, wọ́n ṣe gan-an ni. Yàtọ̀ sówó registration yẹn kò sówó mi tán gbà lọ́wọ́ wa.
The way they treat us is very, very nice. I'm even inviting my friends to this place. I've invited like 3 or 4 people to this place. So there's another help that they are giving to us again, free medical care. They are telling us that when we deliver our child, we are not paying any money. So I'm thanking God for this, because I have 3 people that have born. They did not correct anything. They are helping us.
Mo wá fún antenatal bíbí, so ọ̀fẹ́ ni free health ni. A tún register ń gbà kan orúkọ wa jáde, àwọn tó orúkọ wa jáde yẹn free health ni. So wọ́n dẹ̀ ń ṣe dáadáa sí wọn bí wọ́n attend sí wa.
Àtìgbà tí mo ti register sí hospital bíbí lókè yìí, wọ́n ṣe dáadáa, wọ́n fún wa ní ìtọ́jú tó péye. Gbogbo ìgbà tá bá wá síbí náà máa attend sí wa dáadáa. In fact, I really appreciate God and I appreciate all the nurses that work here. Mo dúpẹ́ lọ́wọ́ wọn, wọ́n really try gan, wọ́n gbìyànjú. Lẹ́yìn ìgbà tí mo fẹ́ bímọ náà, wọ́n attend sí mi, kò sí any problem. So I thank God and I thank them also.
So mo wá síbí, mo wá gba abẹ́rẹ́ fún ọmọ mi. Láti ìgbà tí mo ti wà ní oyún, mo ti ń wá síbí títí tí mo fi bímọ. So mo dẹ̀ ṣe mo wá gba abẹ́rẹ́ fún. Abẹ́rẹ́ tán dẹ̀ fún wọn ọ̀fẹ́ ni. So wọ́n dẹ̀ gbé mama kit náà fún wa nígbà tá a bímọ. Tí Ẹ̀rẹ̀lú ìyàwó gómìnà wa tó ṣe fún wa táwọn kan tán lè lò fún ọmọ ìmídélé tàbá bímọ ó wà nínú ẹ̀ náà wọ́n gbé fún wa níbí báyìí gbogbo ẹ̀ náà ṣe fún wa a dẹ̀ dúpẹ́ lọ́wọ́ wọn fún ìtọ́jú tó ń ṣe fún wa.
Also early in the life of the administration, a comprehensive site restoration campaign was carried out across the state that cut across different age brackets, bringing succor to many with deteriorated eyesight.
Òpinlẹ̀ Èkìtì, ulẹ̀ òyì ní, òpinlẹ̀ Èkìtì ìmọ̀ ti gòkè àgbà o.
2019, we started with free health mission across the 16 local government area of Ekiti State. It was also a time that the federal government, through the Ophthalmological Society of Nigeria, were trying to evaluate cataracts and causes of blindness in the country. And so Ekiti State government funded that campaign and the subsequent surgeries in Ekiti State. The testimonies were all over. We saw well over 20,000 Ekiti citizens give care, surgery. That exercise in itself helped us to appraise our health system as it was, helped us to appraise the health-seeking behavior of Ekiti citizens.
Initially, we did what we call the PAC facility assessment. That's primary healthcare facility assessment. And why Mr. Governor gave an approval to do that is that we wanted to see what the gaps are, where are the gaps within the 16 local government and within the major 177 wards that has the capacity to be able to meet all the PAC functions, all the PAC services, to be able to render PAC services at that ward.
There are 17 primary healthcare facilities that are being renovated as we speak. 8 has been completed, 9 will be completed sometimes end of this month, which is this week. And this is an ongoing process. Some of the things we did for some of those facilities, borehole was sunken because there was no water. How can you prevent infection when you don't have water? Some of them were providing some solar light. Some of them complete roofing, decapitation of the roofs and putting a new roof, painting. The Okeyimi Primary Health Center, we're actually putting a new building, an additional building in Okeyimi Health Center. And it will be having 8 more delivery rooms. There'll be waiting rooms, there'll be antenatal ward, there'll be postnatal ward. So it's a full maternity hospital and that's what it is, because it's one of our busiest primary health centers in Ekiti State. They have 100 births. We want them to extend it to 200 births. We don't want people to go and have deliveries because there's no place for them to have their baby. A tertiary institution, which is the State Teaching Hospital, was not left out. If you notice, I don't know if you've been around there, there's some painting going on. The place has been painted. The roads have been done because the gullies made it a little bit difficult to ride a place in the past. So it's more motorable now. It's more accessible. We are creating access to most of our facilities. So patients can actually be driven into those facilities. Meanwhile, we are equipping them with some other equipment. Some are donations, some are being procured by the state. And these are ongoing things that we are doing.
Coming from to where we are now, this government has put in every effort to ensure that workers' dues are paid on time. Coupled with that, like I mentioned earlier, that some allowances that were not paid for specialists before now were also approved and paid with arrears by this government. That I think is welfare. But especially at this time of COVID-19, one of the things that Mr. Governor has made available is the COVID-19 allowances for those in the forefront, in the core facilities seeing COVID-19 patients. And very recently, Mr. Governor also approved payment of hazard allowances to all category of workers in the health sector. Coincidentally, it's the same governor that approved the revised comments in his first term. Is also the one that has come back to approve the payments of hazard allowances, which we never used to get, and the rural allowances. I also want to say that Mr. Governor has approved consequential vacancies being filled at the primary healthcare level, and right now recruitment is ongoing at that level of care. So I can boldly say that this administration has touched every sector of healthcare delivery.
Disease control. Little did the present administration know what was ahead when it made disease control a cardinal program in its healthcare delivery. The government was committed and indeed working towards fending off other diseases, especially Lassa fever, from the state when COVID-19 made its fatal entry into the global space.
As if we were preempting COVID-19 coming on board. Late last year, His Excellency supported us, gave us a space where the Emergency Operations Center will be put in place in Ekiti State, and we started preparation. And I think it took us to February this year, February or early March. The Emergency Operations Center was established in Ekiti State. Shortly after that, COVID-19 came on board. His Excellency is the first governor in this country, even before the federal, to start the Ekiti Task Force, the Ekiti COVID-19 Task Force. I remember it was March 2nd, and we had our first case March 18.
But it was a prepared state that COVID-19 met in Ekiti. The state courageously took up the challenge against this virulent disease to defend ourselves and save the people from the fatal scourge.
The earlier you detect your cases, the better for you to manage, the better you are able to trace the contacts and minimize the spread, which has really, really worked for us. If you look back on the cases we've had in Ekiti State, despite we've been in this for the last, I believe, almost 6 months now, almost 6 months, we're just about 218 cases. As you would have expected our cases to have risen more than that, but it hasn't, because of, sensitization, health education, advocacy, and the grace of God. We work, we continue, day in, day out. We have complete EOC set up, which has all the 7 pillars: the surveillance, the risk communication, the laboratory, the logistics, the coordination. Everything that is needed was set up. So our surveillance group kept going around, taking samples of suspected cases and contacts. Our risk communication keeps going around, educating the community, going to the marketplaces, churches, mosques, schools, everywhere in the community. And everything was going hand in hand. And as we were doing that, we continue educating our personnel, because COVID-19 is a novel disease. Nobody has ever had it before. So we continue continuous education. I believe we did it for 6 weeks to 8 weeks. Continuous education of all our healthcare workers.
Government's continuous public enlightenment, enforcement of compliance to prevention protocols, committed frontline personnel, timely response to incidents, and a largely cooperative citizenry have all contributed to Ekiti State's current statistics on the National COVID-19 Index table. The health sector in the state is also better for it.
Of a particular importance is the Obade Hospital, which happened to be the pet project of Mr. Governor. The hospital is back to life and well equipped beyond the COVID. So the COVID-19 has brought about some high level of commitment, especially in the tertiary care and also in the secondary care. We've gotten so much attention, and of course, some equipment that maybe naturally we would have struggled to have, we now have them. We have so today we have a molecular laboratory in the state. And another thing that this has done to us is that it's been able to help us to build the capacity of our scientists, of our healthcare workers in core areas.
With the ingenuity and pragmatism of our governor, it is true it's depleted the state's resources, as in COVID, but it has also improved health system in a couple of ways. I would say that the investment that has been made into the Obade General Hospital, the isolation center, has been in hundreds of millions. Some of the funds that were gotten from the resource mobilization were plowed back into the system.
Came on board on August last year. We have only 7 beds at Obade here. But now, we have more than 170 beds that is functioning. Not that one alone. The walls upstairs were renovated, and they gave us some equipment worth millions of naira. Initially, we have been not connected to national grid, but during this COVID time, they were able to give us a brand new transformer. We used to purchase water every time, like about tanker of water 2 times in a week. But now, during this period, they were able to reticulate us, and they connected us to the water corporation here. We now have water, we have light. It was able to purchase us a big Meccano, about I think it's 40 kVA, that's supplying the main the isolation center and the general hospital.
As part of the continuous efforts to improve the health care of the people and in keeping with the promise of building an healthy human resource, Governor Fayemi recently launched a state health insurance scheme to, among other benefits, guarantee access to affordable and quality health.
This program will ensure protection of Ekiti families from financial hardship of huge medical bills, ensure sound health of our children, and safe delivery of our pregnant mothers in the first instance. And also, no one will be turned away from our health facilities for not holding cash in hand in the long run.
So 71 healthcare facilities in Ekiti State as we're speaking. When you go there, you are pregnant, they register you. You don't have to pay a penny for registration, for care, for delivery, for postpartum care, and for immunization for your children.
That means that every woman in Ekiti State can carry her baby to delivery and post-delivery free of charge. That is very crucial if you know what maternal mortality means to a nation or to a state. And I'm not surprised because the last time we had the greatest push at this was during Mr. Governor's first term. We had the MDG maternal and child health program then. That was a program that spanned across the 16 local government area in Ekiti State, which was unique to Ekiti State only because at the time, all the other states had just maybe a third of their local government benefiting from the program. But in the 2014 era, it was across Ekiti State and it was adjudged one of the best programs in the country there.
As of now, the indices are already looking good for the state, even as the state continues to expand its capacity.
Looking at another 2 years of sustainability of Ekiti State healthcare system with good health indices, and people clapping for us that our data is doing well across board.
As bad as the economy is, the health sector has witnessed a degree of improvement in infrastructure. And if we do continue this way, in the next 2 years, every arm of the health service delivery will be touched in infrastructure. Every arm will be touched in capacity strengthening, in system strengthening. And very importantly is the health insurance scheme. That is one tool that is capable of sustaining financial input into the health system. With that, I think the health system is set to deliver on its promises.
But we will be a place to reckon with, because human capital development is ongoing too. We're hiring, we are bringing more doctors, more nurses, and this is going hand in hand with the renovation. And we are going to be equipping. You remember I told you about the Basic Healthcare Provision Fund that just came in? It's going to be used for that purpose. They're going to equip our facilities. So there will be nothing that the private institutions will have over us. It will just be a matter of management and for everything to be in good hands.
Indeed, no one should die again as a result of rundown healthcare facilities. This administration is no doubt working at it. Let's now look at our fact file. That's our package for this week. You can watch this episode and previous ones on our YouTube channel as well as our other social media platforms showing on your screen. Please continue to stay safe and be a good citizen. Goodbye.
Ekiti